talking about cerebral aneurysms or brain aneurysms. Explain to the viewers at home, what exactly is that?
So a brain aneurysm, I don't know if you can get the slides, is a weak spot in the vessel. I don't know if you can get the slides shown. So this is a normal vessel, that you can see here, and you can see all this is basically, instead of the normal structure, the artery can probably blown away by some pathological process. And as a result, of course, the wall of the artery is very weak, and this bubble, so to speak, can burst. In this case, this patient had one upper bubble here with multiple other small daughter sacs, we call, and another aneurysms in the bottom part. So this patient in the same vessels have two aneurysms. As you can imagine, I mean, these are inside the brain. So if the wall of the artery is so weak that it actually bursts, then blood will gush out inside the brain with, of course, devastating consequences, death in some cases. And then, of course, in order to fix it, you can imagine you have to kind of reconstruct the whole vessels to a normal function, so that reinforce it, so to speak, so that this thing doesn't burst anymore, or doesn't burst in the first place.
So where exactly in the brain are you most likely to have an aneurysm?
Most of them are in the front part of the brain. It's called anterior circulation. But I would say 15–20% are also in the back of the brain, called posterior circulation, like in this case. They are, posterior circulation probably more deadly because the back of the brain is very small. So when you bleed, when patients bleed inside this small compartment, then the consequences are terrible. But brain aneurysm in the front part of the brain are also very deadly, because the blood goes, and of course the brain is contained in a closed box, which is the skull. So you cannot really have too much fluids coming in. So whenever blood gushes in, it's like an explosion inside the brain for these patients.